Well, thank you very much. I'd like to add my congratulations to Lars and Christina, not only for this wonderful and informative meeting, but also for all their accomplishments over the last 10 years for the Bone and Joint Decade. The topic I've been asked to discuss is collaboration. And we actually have a saying in the United States is when you're talking about something that everybody believes in, everybody loves, it's like Mother America and apple pie. In this venue, maybe we're talking about mother and apple pie, but certainly collaboration is not something that I need to sell to this audience. How can we use collaboration to achieve our aspirations? And in order to explore this topic, I'll tell you what we have done as a National Action Network over the last 8 years. How do we define collaboration? It's fairly straightforward: to work jointly with others or together, the act of working with another or others on a joint project. Unfortunately, it's not always practiced by the healthcare community or any other for that matter. However, it really is essential for the success of our mission. Why collaborate? It's fairly obvious. It's required for the benefit of our patients. It's likely to increase knowledge base and understanding. And like free trade, collaboration is necessary to break down barriers so that we can grow faster and achieve our mission more directly. Certainly collaboration has been part of our vision and mission. It's implied in our vision statement to be the effective coalition of patient-focused and professional organizations that improves bone and joint health in all persons in the United States. So the collaboration here is forming this coalition. And collaboration is actually explicitly mentioned in our mission statement: to promote and facilitate collaboration among the public, patients, and organizations to improve bone and joint health through research, education, and advocacy. The U.S. Bone and Joint Network is a collaboration of 100 participating organizations, 55 of which are dues-paying members. And no organization is excluded. Even if they didn't pay dues, we still seek their input in our programs. Every program that we've established to date includes all the relevant stakeholders, and all programs are approved on the basis of alignment with this mission of collaborative interaction. Here are some examples. We've heard about this, burden of musculoskeletal conditions in the U.S. This actually was one of the brainchilds of Stuart Weinstein, the first president of the U.S. National Action Network, when he was the president of the American Academy of Orthopedic Surgeons. The AAOS had previous volumes of this edition, but in order to move it forward, we sought collaboration with other organizations through the U.S. Bone and Joint Decade to make this a reality. And this is an important document that supports our advocacy efforts, it supports our research grants, it's multidisciplinary by its very nature, so it's well suited as a decade initiative. And in fact, it's more resource intensive or too expensive for any one group to undertake. Furthermore, if AAOS did it alone, it would not be considered inclusive. So we had a coalition, a collaboration of a number of organizations, including the AAOS, the American Academy of Physical Medicine and Rehabilitation, the American College of Rheumatology, American Society for Bone and Mineral Research, the Arthritis Foundation, the National University of Health Sciences, a very prominent chiropractic educational institution, the Orthopedic Research Society, and the Scoliosis Research Society. And all of these societies contributed not only financially, but also intellectual capital and content expertise. So this is a very important collaborative project that came to fruition in the first 10 years of the U.S. Bone and Joint Decade. You've heard about Project 100, professional education, as Steve Katz mentioned yesterday, and is shown in this slide in the picture on the upper right. This discussion really came out of one of our first meetings of the Bone and Joint Decade at the NIH, where it was realized that our population of physicians did not have optimal education in musculoskeletal sciences and clinical musculoskeletal medicine. So our goal was to have 100% of medical schools to offer a formalized musculoskeletal education, and we've done that largely, as Steve Katz said, through trying to get this tested by the National Board of Medical Examiners. In the first 8 years of this initiative, we've really focused on allopathic medicine, and it was championed by orthopedics, rheumatology, PM&R. But as we move forward, I think we're going to seek a broader definition of musculoskeletal training and also try to get musculoskeletal medicine in curricula of our allied health science colleagues, including nursing. The Young Investigators Initiative is also a very important collaborative event of the U.S. Bone and Joint Decade and also the Bone and Joint Decade of Canada. The goal is to increase research funding, and we can only do that in our very competitive system by writing more and higher quality applications. That's what we hear from our colleagues at the NIH. Write better grants, you'll get a bigger share of the pie. So we recognize that, and with the Bone and Joint Decade of Canada, we created this multidisciplinary program consisting of orthopedic surgeons, rheumatologists, physical therapists, physiatrists, kinesiologists, dentists, occupational therapists, anatomists, biomechanics, etc., all working together to educate our trainees on the best way to write competitive grants. It's proven effective as a cross-disciplinary knowledge exchange, and to date, 82 grants have been received by our trainees with over $40 million in research funding. So this has been a shining success and something we certainly think we want to leverage as we go forward. Other collaborative programs, including our public education program on bone health and osteoporosis. Partnership is the key to this program's success, and our partner organizations include not only healthcare providers, but also non-healthcare provider organizations, including the organizations listed. I'm not going to mention all of them, but again, you get the sense of the collaborative nature of this program. Experts in Arthritis is another public education program. It's a free forum for patients and their families, and partnerships likewise have been a key to success. The collaborative organizations include those listed. We had our last global conference in Washington, D.C., and this was also wonderful evidence of collaboration where we focused on public awareness and advocacy and developed a roadmap for the future. This was an opportunity for all 40 U.S. organizations and their leaders, including thought leaders, to gather, and this was one of the first such gatherings that we've had in the United States for a very long time. Through this process, we have developed a roadmap for the future, for the U.S. Bone and Joint Decade and beyond. So the U.S. Bone and Joint Decade will be called the U.S. Bone and Joint Initiative, and there will be a continued focus on bringing the musculoskeletal community together, developing collaborative programs and advocacy. And I would suggest, at least in the U.S. Bone and Joint Decade, soon to be the U.S. Bone and Joint Initiative, is a unique organization in that it brings disparate groups together, sometimes who don't necessarily talk to one another well, but it brings us together where we can find common ground. The next steps for our organization, we have defined 4 main activity areas through our strategic planning process. Many of you participated in this at the global meeting in Washington last October. Our activity areas are advocacy and awareness, access to high-quality musculoskeletal health care, a major issue now that we face healthcare reform in the U.S., data assessment and dissemination, the burden of musculoskeletal disease is an example of that, and of course interdisciplinary programs and forums such as those I've mentioned, including the Young Investigators Forum. There is definite value for belonging and value to being part of this collaborative organization. In the U.S., we represent the only organization that assembles the broad musculoskeletal community and has patient advocacy organizations and musculoskeletal organizations as members. It has and will continue to provide a forum for communication among patients, patient advocacy groups, providers, payers, and industry representatives for collaboration on optimal treatment and prevention of musculoskeletal disorders. We offer a single credible voice for all segments of the organization on issues of common concern and offers problem-solving abilities on musculoskeletal issues that are truly a multidisciplinary collaboration. So on this basis, our organization will move forward. So how can collaboration enable us to achieve our aspirations? Well, basically, this is essential for the success of our mission. Thank you very much. If you have any questions about the U.S. Bone and Joint Decade, please refer to our website. Thank you for your attention.